Hello, this is Dr. Shemin speaking. Today I'm going to discuss with you other issues regarding the long-term after effects from COVID infection. Now, we've discussed in the past that some people who've had asymptomatic infections still have long-term loss of sense of smell, loss of sense of taste, headache. Some also have difficulty swallowing, hearing loss, and even tinnitus. But today we're going to discuss an issue regarding patients who've had symptomatic COVID infections, namely that they've been admitted to the hospital and had intubation. Now, many of the patients have long-term intubation, and one of the side effects of long-term intubation is that there's tracheal stenosis, in other words, narrowing of the trachea. Now, to show you what I'm talking about, this is the larynx and this is the trachea over here. Now, what happens with tracheal stenosis is that from the endotracheal tube, which is indispensable in providing air for the patient, if it stays for a prolonged period of time, you ultimately get narrowing of this part of the trachea. And that can cause difficulty breathing, it can cause sleep apnea, it can cause difficulty with vocalization. So we have some different ways of dealing with subglottic or tracheal stenosis. Now, picture it like this. This is the trachea. When we're saying that there's subglottic stenosis or tracheal stenosis, it's as if you have some stuffing in the trachea. So one of the techniques that we have, and I've shown you this with nasal reconstruction, we can put a balloon in and dilate the trachea. So that's one of the easiest ways. Other ways we can do it is, aside from dilatation, is injection. We can try other means, or laser, trying to open up that airway. But if those techniques are unsuccessful in eliminating the tracheal stenosis, the next technique then is to actually resect or remove that portion of the stenosis, as you can see over here. And we remove it, and then we join the two ends of the trachea together. So that is the options for tracheal stenosis, and these patients then do very well with their airway. So again, the options are either using balloon dilatation, injection, or laser, and if that fails, going on to resection in order to achieve the normal lumen or normal circumference of the trachea so that the patients don't have shortness of breath. Thank you very much for your attention. Have a good day.